Introducing Remote Therapeutic Monitoring, an end-to-end program that helps you qualify patients, enroll them through the portal, and track their progress with recurring surveys and threshold-based alerts. Each month, all that activity is automatically summarized into a billing note and prepared for claim submission. To get started, your practice will need to reach out to us directly to have RTM enabled for your organization. Once it's turned on, providers can begin qualifying and enrolling patients right away. Patients don't need to do anything extra to qualify. During a visit, if the provider adds one of the qualifying diagnosis codes to the visit note, the system automatically flags that patient as eligible for RTM. Once the note is finalized, a pre-built template is inserted into the plans section of the note, and the provider can select from clickable keyword options to customize it. The patient receives a text and email the next day with a link to an informational page on the patient portal. This link stays active for 1 year. When the patient completes the enrollment steps, they're officially enrolled in the RTM program. Enrolled patients receive a check-in survey every 15 days by text or email. The survey covers 6 to 7 questions about the patient's pain and the condition being monitored. Depending on how a patient answers, follow-up questions may appear, and for example, if a patient reports their condition is worsening, they'll be asked a few additional questions to capture more detail. Every response is saved and tracked over time, continuing automatically for up to 1 year. After a response is saved, alerts are triggered if the record requires review. Clicking on the alert opens the patient's RTM progress chart, giving the clinician a holistic view of the patient's response trends over time. From there, the clinician can view the data submitted and decide how to proceed. Once they're done, they can mark it as reviewed. There's an RTM triage dashboard that clinicians can view to see a consolidated list of all enrolled patients and their conditions. They can directly review the records from here. Thresholds for when alerts get triggered can also be set from here. Each provider can set their own thresholds for what counts as concerning patient responses. These thresholds are specific to that provider, so different providers can define attention-worthy differently. From there, providers can see each patient's trends over time, including their PEG-3 score, which is the average across all 3 questions, along with pain levels, condition changes, and care plan adherence, all in one view. There are also summary views in the dashboard, making it easier for clinicians to organize items based on status and priority, as well as filters to only see the items preferred. On the 30th of every month, the system automatically creates a single visit note summarizing all the check-in data collected for that patient, along with the claim including the details. Once ready, the claim moves to draft status on the charges page. If the patient has insurance on file, the claim will automatically be set to ready instead. Providers can review the visit note and make any updates before it's finalized. That's RTM, from qualification to billing fully automated.